Welcome back into Everyday Kentucky. We're here with our friends again at UK HealthCare Sports Medicine. Walker Terhune is with us. He is a clinical sports medicine
athletic
trainer. That's right. I was going to give you a much more flowery, but I guess the biggest difference is there are trainers that are out in the field, but you're just here in clinic.
Correct. Yeah. Previously, as we just mentioned, I've worked for 25 years as an athletic trainer. My first job, I was a head athletic trainer at Kentucky State University.
Really?
And then did that for 5 years, and then I was at Woodford County for the past 18, and then made the switch to work in the clinic since 2023. I think, yes, that is correct. And so I am not on the sidelines anymore.
Okay.
Just in here working with our doctors, our nurse practitioners, our physician assistants, and such like that.
It's still an important, it's very different than what you did before, yes, but it's still critical to the athlete rehab process.
Yes, I mean, we work with our doctors, like I said, our doctors, nurse practitioners, PAs, kind of coordinating our patients' care as they go through their injury cycle.
Sure. We talk a lot, obviously, about athletes because that's who you work with, but it's everyday people as well. So what is the patient population that you see in here?
We'll see patients aged 8 and up. We'll see our school-age kids. Then we'll see our athletes, our middle school, high school, college, professional. And then we've got our weekend warriors, and we've got our older population that's still active. Everybody that we see, we consider an athlete.
Okay, so I'm going to guess. I don't want to use the term middleman, but I mean you're not on the sidelines. So then you turn around and you're not only getting the reports from the sidelines, but then you're the communicator with the physician as well. What's that whole process like?
Oh gosh, that's a lot. So, we're seeing those patients. We might see a patient first thing when they come in. We may be the first one to see them. We'll start their documentation. So we'll see that patient, or talk to our physician, our nurse practitioner.
Right.
And so we'll get all that documentation started, but we'll also relay what our evaluation was in the room, and then work with the doctor from there and kind of, just determine their treatment plan.
And it's really something where you all work hand in hand together. I mean, you kind of formulate a treatment plan, and then I would guess that you're the person that as you go through that treatment plan, that tells you and the physician if your initial thoughts were what you thought they were.
Yes, and it's always nice when you can see a patient, you go out and you talk to your doctor and say, hey, this is what we're seeing. Doctor goes in and sees them. Oh yeah, I agree with that. I think that's a good idea. And the nice thing is too, we'll see them on the front end, and then also we're there on the back end for any phone calls and things like that. So
Sure.
That's our kind of administrative side, outside of our patient care side.
Walker, let me ask you one other thing, and I've always wondered about this. Do people need to get a referral from their primary to come over here and see you all?
We have a walk-in clinic.
Yep.
For our sports medicine walk-in clinic from 7 to 8 a.m. for our athletes. We also have a what we call a non-sports, orthopedic walk-in, and we run that from 8 a.m. to about 11 or 11:30. Technically, we go till noon, but that's kind of when the clinic finishes up.
Sure.
You may need a referral depending on your insurance.
Right.
So, but otherwise, if you come in the door, we're going to try and do our best to help you.
And you do that every day. Thanks, Walker.
Absolutely.
Great visiting with you. And of course, you can get all the information on the website at ukhealthcare.com/ortho. And we'll see you next time on Everyday Kentucky.